Knowing what to do in the first minute of an emergency may mean the difference between life and death. When approaching a patient first, make sure the scene is safe for you and the patient. Your initial action is to check for responsiveness. If a patient is unresponsive, call out for help and an AED. If someone arrives promptly, ask him or her to call the emergency number 112 or 999 immediately. Then get an AED. If you are alone, call the emergency number 112 or 999 yourself and get an AED if one is available locally. With the patient on a firm, flat surface, open the airway by placing one hand onto the patient's forehead. Place the fingers of the other hand on the side of the jaw. Now tilt the head back and lift the jaw forward. This will move the tongue away from the back of the throat and open the airway. Clearing the airway may be all that is needed to help someone begin breathing. Next, place your ear over the patient's mouth and look towards his chest. You check for breathing by look, listen, and feel for normal breathing for 5 to 10 seconds. You look at the chest to see rise and fall. You listen over the mouth to hear the patient breathing and feel the patient's exhaled air against your cheek. In some patients, you may see occasional gasps called agonal respirations. This is inadequate breathing. If the patient is not breathing adequately and/or is gasping, give them 2 rescue breaths, then immediately begin chest compressions. Your instructor will now take you through the initial patient assessment procedure in your groups.